Now, how would the link be? I mean, what's happening there? You've got this septoplasty and you're
Hmm.
doing, you're treating deviated septums and you're doing this balloon procedure. Now,
Yes.
someone has like they eat and they totally intolerant to, let's talk about maybe an oxalate or leptin. I had Sally Norton on the show,
Hmm.
they had Dr. Gundry on the show. They have
Hmm.
something, there's a huge, rich, supply of nerve fibers to the gut. They have a
Hmm.
reaction straight away. They get like a migraine or a migraine, as we say it here. Now I'm starting
Hmm.
to adopt the
Yes.
American way to say, but
I like it. I
you know,
like it. Migraine,
but
migraine.
migraine, migraine. But then all of a sudden, do you think there's some type of neural network that either can come from the neck or can come from the gut or can come from light that then passes through this area where you are correcting the abnormalities and you're releasing pressure on the central nervous system or the autonomic nervous system that sort of like changes the circuit so that if someone has that cheese or wine or that chocolate or someone turns their neck or uses their neck too much at a PC that would normally have
Yes.
given them the migraine, but now you've
Right.
released that pressure somewhere along that track and now they
Hmm.
don't present with it.
Right. I could talk to you all day about this. You are so intuitive. You are hitting on all the high points, and I'm just my mind is just going with excitement. Um, Absolutely. Let's talk about the anatomy of the nose, and let's relate it to the recent COVID outbreak. The easiest way to explain what I do is if you've ever had the original COVID test, it hurt when they put the swab in the back of the nose. Why? Because there are structures called turbinates, which are very sensitive, but they're the air conditioned coils of the nose. They swell and shrink in response to colds and flus and hormones. They also swell and shrink in response to chocolate, wine, things like that as well. So, but they don't like to be touched. So when you have that abnormality, namely the number one abnormality I treat, but it doesn't have to be present all the time, is a deviated septum. Why? Because the nose protrudes from the nose, from the face rather, and it can get injured easily. And it doesn't have to get broken. It just has to get hit. A baby's head in a mother's lap, an elbow during basketball or soccer, things like that. When you have that abnormality poking on the turbinates, then you get that referred pain. So I've had a woman, a young lady, who was 17 years old with migraines, but also had irritable bowel syndrome and cramping. She could not eat pasta or pizza. So she comes in after a third visit. She goes, Dr. Smith, my migraines are gone and everything's fine. But she goes, oh, but by the way, Dr. Smith, she said, I'm able to eat pizza and pasta and I'm not always bloated. My stomach feels so much better. So I made a middle note of that. Had another woman who, weeks or months after her surgery, my migraines are gone, Dr. Smith. But you know what's so crazy, Dr. Smith? I was like, what? She said, I've had constipation since I was 19 years old and it's gone. And I made a mental note of that. So that had me on an investigation about what else are migraines associated with. And so when you read that and search that, you'll find that migraines are associated with at least 75 neurological disorders: MS, epilepsy, dementia, Parkinson's, Alzheimer's, ALS, cerebral palsy, autism, Tourette's, irritable bowel, Crohn's disease, um, retinitis pigmentosa, and the list goes on. So I took a deep breath and went, okay. But nobody knows the association. Why are migraines associated? But they know they occur with each other higher in a higher percentage than they do alone and with other diseases, these disease states. So the way my mind works is let's get some Parkinson's patients in here and screen them. If migraines associated with Parkinson's, then let's screen some Parkinson's patients. And I've had several come in, they have the same abnormality as my migraine patients. In fact, I just did a procedure on a gentleman who had headaches, sleep apnea, migraines, and Parkinson's with a horrible tremor. And it's been less than a week. He hadn't even been a week from his surgery, and he already posted on my Facebook page that his tremor went away. And I told him, I said, well, You have medications on board, the pain medicine. I gave you steroids for the surgery. We're going to let you go out a little further. But I don't think if I'd operated on his toe, his tremor would have gone away. You see what I'm saying?
I got you.
So the fact that I operated on his nose and the tremor went away, he said, in fact, I've forgotten I even have Parkinson's on the post. I didn't ask him to do this. I read it last night and almost cried, because here's a gentleman who is almost forgotten he's had Parkinson's 3-4 days after his surgery. So all that to say is, if migraines are related to all these conditions, then absolutely it's tied into the autonomic nervous system. Because when you think about, the body is made up of nerves, and every cell in our body is controlled by nerves. If there's an irritated focus in your nose, constantly having you in a fight or flight stance, it has to affect the rest of the body in some way, which then goes back to that cortical depression. In some people, they get visual disturbances. Other people might get constipation and not know why they're always constipated, and might not even have headaches. There is a condition called silent migraines, where you don't even get the headache, but you can still have the abnormality. And that abnormality can be stimulating this irritated focus that's going to your brain, disseminating through your body. And somebody gets cramps, another person gets Parkinson's-like symptoms, another person has tremor, another person stutters, another person has facial tics that they don't know where it originates from. So my thing is, for all those people, you need to get a sinus scan. I think down the road, we're going to be screening people with sinus scans to check for these abnormalities, because you don't know who's going to develop a migraine, who's going to develop ALS, who's going to develop dementia and Alzheimer's and Parkinson's and MS and epilepsy, and you don't know. So it's going to be a screening process whereby you look for that, correct that, and you eliminate a lot of disorders in this world, or at least influence them.